Good morning, good afternoon, good evening, everyone. Really pleased to be here with you today. My name is Aaron Buxbaum. I'm a Senior Knowledge Management and Learning Officer with the World Bank Group, and I work with the Social Protection and Labor Practice here in Washington, D.C. It's my great pleasure to be your moderator today and to welcome you to this collaborative webinar with socialprotection.org, which is Aspire in Action, Tools and Methods for Measuring Social Protection and Labor Performance. Go to the next slide. I am excited to be here today because this is all about data, and this is about how we keep data fresh, how we know data is trusted, vetted, current, and the Aspire team that's here today, who I'll introduce in just a moment, is going to give you an amazing introduction to the newest set of tools that they've been producing and help you to understand how to access the resources that they've created to allow you to understand social protection program data from around the world. So with us today are Victor Sulla, Sofia Martinez, and Belen Fontañez. Victor and Belen will start off our agenda today. I'll skip back to the agenda in a moment to help you understand the Aspire portal or an overall how Aspire functions, and then Sofia will come in and provide us with a demonstration of the website, the portal, and the tools themselves. A few notes just as reminders for being here on the Zoom today. Number one is that the session will be recorded. So that will be available on socialprotection.org after the session. Second is if you would like to follow along with closed captions at the bottom of your screen. If you move your mouse cursor down to the bottom, you'll see a button that allows you to turn those on. The captions will appear in English, and all of the session live language will also be in English today. I'd like to welcome everyone to use the chat box right now to introduce yourselves, say where you're joining from, which institution you're with, and throughout, please feel free to share relevant links to additional resources that follow along the themes of the webinar. And finally, when we come to Q&A after Sofia does the demonstration, please make sure to share your questions through the question and answer box that you'll also see at the bottom of the screen and the icon that's indicated there. Or if you like, you can also click the raise hand button, and then I'll make sure to call you out by name and identify you, and then our partners at socialprotection.org will be the ones who will unmute your microphone and bring you in to speak. So with that, I'd like now to turn the floor over to the Aspire team. So I think, Sofia, you're going to go ahead and start sharing your screen, and then I'll invite Victor as the first speaker to come in and begin giving us an overview of the Aspire portal. Thanks so much.
No. Hello, everybody. My name is Victor Sulla. I'm leading Aspire team at the World Bank, and I will give you a short introduction now about World Bank social protection job practice and our group and our data. The World Bank social protection and job global practice help countries protect people from poverty, build resilience, and create opportunities for work and inclusion. We support government in designing and improving programs such as cash transfer, social pensions, delivery system, employment activities, all those programs that make real difference in people's lives. The social protection data and analytic groups focuses on data, making sure we have strong, comparable evidence across countries. The team manages Aspire, the World Bank's global database on social protection. The goal is to turn data into evidence-based policy and insights to help countries make better policies. Aspire is one of the most comprehensive databases on social protection and labor. It brings together harmonized microdata from household surveys, administrative data from national systems, and metadata from close to 5,000 programs across 130 countries worldwide. Built over a decade, Aspire integrate households and administrative sources to produce harmonized indicators. The indicators really measure how much people receive in social protection, how effective the system in reducing poverty. What makes Aspire unique is not just its scale, but its comparability. Using consistent definition allows us benchmarking performance across countries, regions, and income groups. Aspire built on two components, two data sources: household survey data that measure benefits and performance of social protection system, and administrative data to measure how much countries spend on social protection systems. Aspire covers most of the world, as you can see on the slide, with a strong focus on developing countries. The database includes harmonized data for over 130 countries across all regions, making it the most comprehensive global source in social protection, while few high-income countries are also included for comparison. Aspire primary focus on low and middle income countries. What are the main objectives? To monitor country progress on social protection and labor outcome, to inform design of programs and policies. Aspire is one of the official data sources for tracking target 1.3 of Sustainable Development Goals indicators, as you know, coverage of the poorest, and to benchmark social protection across countries and time. Thanks to harmonization methodology, it ensures comparability. So Aspire data are used to understand, compare, and improve social protection system around the world. Government rely on this indicator to see how many people their program reach, how much support beneficiaries receive, how efficient resources are directed to the poorest. The World Bank uses Aspire data to prepare country briefs, policy notes, the regional global reports, and including State of Social Protection report, the flagship analytical publication. The recent one was published just this year, and the State of Social Protection report 2025 shows in a major global progress. Social protection programs now reach 4.7 billion people, yet nearly 2 billion people remain uncovered or insufficiently protected. Coverage has grown, but benefits often remain too small to lift households out of poverty, especially in the low-income countries. The report calls for urgent action, extend coverage, improve adequacy, build stock response system, and ensure sustainable financing so that social protection can truly serve as a universal foundation for resilience and inclusion. This is a global report, but the most important work for us is really the country work, where we work on country by country, provide comprehensive indicators describing the social protection system. And today we will show you some highlights of our data. We'll show you our visualization and summary tables of our data. We will show you how the data query and happening and how you can extract the data and see the results. We will also talk a little bit on the methodology, and really how the data could be used and what is the way for you to use this data effectively. Important to say that our data are publicly available. We share this data on our portals and the World Bank systems, and it is used by many partners in their work, in their day-to-day life already. It's very easy to obtain, and also we can respond to your request. If you have very specific request for the data, you can turn to us and we will be happy to share the information with you and also give you explanation of the definition, methodologies, and so on. Now I turn the presentation to Belen. Please continue the discussion on the methodological part on our framework. Thank you.
Thank you, Victor. Okay, so as Victor was saying, I will explain a little bit on the methodology of Aspire. So here we have the Aspire Social Protection and Labor Framework, which basically encompasses three main areas: social insurance, labor market programs, and social assistance. Within social insurance, Aspire collects data on contributory pensions, which mainly collects old age, survivors, and disability pensions. And within the household survey data collection, we also include other social insurance programs. Within the labor market programs, we contemplate active labor market programs, which includes job training, wage subsidies, employment incentives, intermediation of the government in job creation as active labor market programs. And within the passive labor market programs, we include the unemployment benefits, which could be contributory or non-contributory. Within the social assistance framework, we collect data on non-contributory programs, which includes all different cash transfers, unconditional and conditional cash transfers. We include the social pensions, which are non-contributory, food and in-kind programs, school feeding, public works, targeted subsidies, other social assistance such as scholarships, social care services, and non-contributory health services. The non-contributory health services, we tend not to include this data on the indicators that you will see that we generally include and not include this data on the indicators, but it will be disaggregated with and without these health services. So as Victor was explaining, we have this harmonization process, and Aspire has two clear lines of work. From one side, we have the microdata process, in which the team, super quickly, I will explain, the team accesses the data from the household service, the team process the service and harmonize them, which means that the team reviews the questionnaires, identifies social protection variables on each of the questionnaires. They classify the program, identified following this Aspire framework that I've just explained, and then they document this data. And finally, these indicators are created using Adept, this software called Adept. For the administrative data process, this harmonization process consists of assessing the data that we already have in Aspire, selecting the country that is going to be updated. The team decides which strategy of data collection to follow, because in some cases, doing this desk research would be okay for some countries where the data is publicly available, but in other countries, we need consultants in the field in order to contact the governments and collect the data directly, contacting the government and going to physically to the ministries. But either way, or with the desk research or field research, once we get the data, once we collect the data, this data is entered into a internal portal at the program level, and the sources are saved in this Aspire internal portal for reference. So this data, after that, we do like this review and curation of the data and check if the programs are well classified. We compare this data with external sources to check the consistency across countries, and we finally generate the expenditures data and the beneficiary indicators. So now we will look into the Aspire indicators that will help us understand the size and composition of the social protection systems. Here we have an example of Peru. And more broadly, what we are going to understand, or what we are going to look into is how big the social protection system is in terms of spending, how many people it covers, how generous the benefits provided through this social protection are, and how effectively these programs are reaching the poorest, and what's the impact of these initiatives on poverty and inequality. So this is, as I explained, this is a snapshot on Peru, but let's deep dive on each of them. So for instance, here we see that Peru spent 1.7% of GDP on social protection. Give me 1 second, because all the messages are popping up, so I can't see the. Okay, so 1.7% of GDP on social protection spending. So this is the expenditure data, which is calculated as the total, the sum of the social protection and labor program expenditure divided by the country's GDP. This is super intuitive, and we have it disaggregated by social assistance, by social protection area, as well as a category. So if you could, there. So here we have the coverage. So for coverage, we have two different types of indicators. We have the coverage as the total number of beneficiaries divided by the total population. And then here, let me clarify something, that for Aspire and for this particular indicator, we consider beneficiary to all the number of beneficiaries who live in a household where at least one member receives a transfer. So in the case of Peru, we are saying that 83% of the population, of the entire population, are covered with at least one social protection program. Or we could restrict this coverage to the poorest quintile. So for instance, if we can do the same analysis, but looking at the poorest quintile. In the case of Peru, we have that 95.5% of the population in the poorest quintile are covered by social protection and labor market programs in the country. So we can also have a look at how generous these benefits are. And to have a look at this, we look into the adequacy. Adequacy is calculated in Aspire as the total transfer amount received by all beneficiaries in the total population divided by the total welfare of all beneficiary households. In the case of Peru, this means that the social protection and labor market programs contribute 9% to the beneficiary welfare. Or if we could restrict this to the poorest quintile. So these programs contribute 13.4% to the income of the poorest quintile beneficiaries. So when we look at the targeting data, what we are looking, this is a proxy on how accurately the programs are reaching the poorest. So what we are looking at here, it's the distribution of beneficiaries, and more specifically, who the beneficiaries that belong to the poorest quintile. So what we are looking, like how it's calculated, it's total number of beneficiaries that belong to the poorest quintile divided by the total number of beneficiaries in the country. So for instance, here we are saying that in Peru, 22.9% of beneficiaries of social protection and labor programs belong to the poorest quintile. And if you see by SP category, you see that for in conditional cash transfers, you have almost 50% of the conditional cash transfers beneficiaries belong to the poorest quintile, indicating that the program that this type of programs are very good targeted at the poorest population. And last but not least, we have the poverty and inequality indicators, impact indicators. So here, these indicators show how much of poverty rates and Gini are reduced due to the implementation of these programs, reflecting their effectiveness in addressing the income shortfalls. So for this particular, like in Aspire, we have different poverty lines, but in this particular exercise, we are using the relative poverty line fixed at 20%. But how it is computed, like we take the difference between the with and without the transfer. And in this case, what we are saying that, for instance, the poverty rate in Peru, after implementing so social protection and labor market programs, reduce the poverty headcount by 40.8%. So now I will let Sofia explain the Aspire tool.
Thank you, Ellen. Okay, so I'm gonna show you how our external portal, as Victor was mentioning, all our information is publicly available. It's a public good, the Aspire project. So here I'm gonna walk you through how to navigate the information that we have in our external portal. So this is the landing page. And the landing page, we're gonna find a little bit of an explanation of Aspire, also some important links that we will go over them afterwards, and also the link to the latest State of Social Protection report, the 2 billion person challenge that Victor already explained. I invite you to look into it if you have. Then what we have in our webpage is the two type of indicators that we calculate. So we calculate the expenditure as percentage of GDP that comes from the administrative data, and also the performance of the social protection programs that we calculate from a representative household surveys. But before this, let me show you quickly. We have in this platform, we have interactive dashboards, heat maps, and graphs that people can log into, and whenever you're interested in a country, you can play around with the tool. So I'm going to walk you through the different type of graphs and heat maps that we have. So in this case, for instance, we're showcasing the social assistance coverage. Here you see the coverage for total population. And you can scroll over a country and you get the data. So for instance, we were looking into Peru, that Belén was showing us. And here, for instance, we say that Peru social protection programs cover almost 80% of the population. We can also see the social assistance beneficiary incidents. For instance, here, if we looked into Turkey, for example, we see that from all the beneficiaries of social assistance programs in Turkey, 53 belong to the poorest quintile. And as well, social assistance adequacy we have here. And if we go and see any other country, for instance, here, Poland, we see that in Poland, social assistance contribute in 22.36% to the income of those that are beneficiary of this type of programs. And then let's go in detail into the different indicators that we have. So if we go to the social protection expenditure, here you would have a brief introduction on the program, how we calculate this indicator, and also how many countries we have in our database. We have expenditure for social assistance programs, but also for social insurance programs. This is done through a partnership that we have with our pensions colleagues at the bank. So they're in charge of collecting and curating this data. So this has a dashboard on public spending on social assistance programs. Here, as you can see, we showcase already some programs, but we can always add programs or even add indicators. As Belen was explaining, we have a calculation of the total social assistance expenditure and also one that excludes non-contributory health services. But in this case, for instance, we can look into add to this dashboard. We could add, for example, Philippines. You can also type the country and you will be able to add. So here we add Philippines. And in this set of countries that we have chosen just to showcase, you see that Colombia spends 2.66% of GDP, whereas Peru spends 1.20 and Philippines 1.21. Then we have another dashboard on total expenditure on social insurance. And here you have showcasing the percentage spent in integrated social insurance schemes in private sector and public sector. So here, for instance, you can choose countries, you can choose regions. For instance, if we choose here a region, let's say LAC, Latin America and the Caribbean, you would have the countries and then how the composition of the social insurance spending is in terms of integrated private sector and public sector schemes. Then we go back, we can also dive into social protection performance indicators, and here is the same. So a little bit of an introduction here, and then we would have indicators that Belen just showed. We would have coverage, we would have the targeting accuracy, the level of the benefit, and the impact on poverty. So in this case, let's take a look at coverage. So here we are showcasing Argentina and Kazakhstan, but and here we're showing not only the coverage of the total population, but also of all the other quintiles of the income distribution. And also we have the coverage of the extreme poor, calculated as the $2.15 per day in US dollars 2017 PPP. Important to mention that we keep on updating this information at least 2 or 3 times per year. So in these upcoming months, we're going to update. We're going to update information and also change the extreme poverty line to the new 2021 PPPs to be in alignment with the poverty team in the bank. So, for instance, here we can add Peru that we were looking into as the example that Belen was showing us. So, and you can add multiple countries, whatever makes sense to compare, you're interested. And so here, coverage, as we saw, the total population, Peru covers 83% of the total population and 95.5% of the poorest quintile. We also have heat maps with all the countries and data that we have that you can scroll over and see. Also, we have here provided indicators for the specific area. So this is total social protection, but we also have broken down by the areas of social protection, social assistance, social insurance, and labor market. So social assistance, for instance, if we click, we will have the same idea, a brief introduction, and then have the same indicators. So
Hi, Sofia, sorry to break in. I'm going to suggest you turn your video off while you continue the presentation, just to make sure your audio comes through clearly. Thanks.
Okay, thank you. There. Okay, thank you, Ar. Okay, then here, if we went in social assistance, for instance, we can deep dive into the targeting accuracy. And here we have showcasing Bangladesh. So for instance, in this case, you can see that social assistance tends to be progressive in terms of how it reaches the population. So for instance, in Bangladesh, the benefits of social assistance programs, 25.9% go to the poorest quintiles. It's a per quintile, and 22.6% to the second poorest quintile. So here we can add, for instance, another country. Let's add Indonesia as an example. And here you see that pretty much social assistance for Indonesia also follows the same pattern of a certain progressivity. We can see the same. This is the benefit, so the amount that is transferred to beneficiaries of social assistance programs, but also you can see this indicator at beneficiary level, so the number of people that these programs reach. Then we can go back, and then we have social insurance. So for social insurance, we have the same idea, a quick introduction, the same indicators. So let's deep dive a little bit on the benefit level for social insurance. So normally social insurance tend to be more generous in the amount of the benefit. So here, for instance, we have two indicators: the average per capita benefit, also calculated in dollars, 2070 PPP. And also we have the adequacy of the benefit. As Belen was explaining, the adequacy of the benefit is the contribution of how much it represents the transfers respective to the income or consumption of the beneficiary households. So in this case, we're showcasing here Bangladesh and Brazil. And as you can see, in the case of Brazil, social insurance for the poorest quintile represents almost like 62% of the income that they receive. In Bangladesh, we can see that in the fourth quintile, social insurance represents 36.96% of the beneficiaries that receive this type of benefits. And then we can go to labor market programs, that are the last area that we have. And unfortunately, labor market programs are not necessarily well collected in representative household surveys, maybe because of their size or because the programs are not included in the questionnaires. But we do have some information on labor market programs. So for instance, here, let's see the coverage of labor market programs in here we're showcasing Bangladesh, Panama, and Uruguay. And here you see it's a very low coverage of labor market programs normally. Okay, so these are the dashboards that we have. We have more dashboards if you wanna see, for instance, regions. If you wanna go to a region, we can go, for instance, to East Asia and Pacific, and in the region sort of profile, what you have here are the key indicators. So you have the coverage of all social protection and labor in the region. These are simple averages. 72% of the population in East Asia and Pacific on average receive at least one social protection program. Then you have the benefit incidence of social assistance in the bottom 20, so 24.4% of those that receive social assistance programs belong to the poorest quintile. These social assistance programs contribute in 29.8% to reduce poverty headcount, and also they contribute 8% to the beneficiaries' income or consumption. Here we have other interesting dashboards. So here we're comparing all the regions, and this graph is interesting because here we are showing also the non-covered, so that people that are not receiving any type of social protection programs. Here we have the composition of the coverage, in other words. So those that don't receive, those that receive only social assistance, those that receive only social insurance, and those that receive more than one benefit. So as you can see, in Europe and Central Asia, 23.9% of the population receive more than one benefit on social protection. Whereas, for instance, in Sub-Saharan Africa, you have like 77% of the population that are not covered, that don't receive any type of social protection program. Then we have other graphs on adequacy and the average per capita transfer, which shows a trend that whenever the average per capita transfer is higher, adequacy tends to be higher as well. And then you have here the simulated poverty inequality reduction. And since we chose East Asian Pacific, you would have here the countries that we cover in East Asian Pacific and what year the survey is. Then we can do the same with income groups. I'm not going to go just because of time. And also you can do a search by country. So if we're interested, for instance, let's say country Ethiopia, for instance. So in Ethiopia, we have, again, the key indicators, like a summary of key indicators, and here we have expenditure, so how big the social protection system is, and we have this broken down by a category of type of program, so unconditional cash transfer, public works in the case of Ethiopia are the biggest ones, and then we have the coverage. And here we introduce another indicator that we have, that is coverage, or any other indicator that we do by urban and rural areas. So I also invite you to investigate these indicators. Here we're showing, so in the case of Ethiopia, for instance, we have some in-kind transfers in rural areas that reach 11% of the population, whereas in urban, they reach 9.2% of the population. Then we have some other relevant links. So here you can build your own report. If you are familiar with the World Bank's data bank, which is the repository of the World Bank's indicators, you can also download our indicators from here, but because of time, I'm not going to show how this works. We also have some tables at a glance, indicators at a glance. So these indicators at a glance are tables that we have put together with key indicators, and you would find here all for the case of the household survey, all the countries and surveys that we have. So for instance, if we click, you would download this Excel file. Let me show you this Excel file. A second. Okay. Okay. The Excel file. Well, let me see if I cannot drag it to my screen, but it would download the Excel file, and you would see the different type of countries and surveys that we have and the key indicators. Let me see if I can drag it in a while, but I will keep on showing you what we have also. So we have this about Aspire that shows it's about the project, what is useful, what are the indicators that we provide that we already have seen. So it's a useful link to learn about us. And then the data sources and methodology. Here you have what data we have available, both from the administrative side and from the household surveys. We have right now 594 surveys. We have indicators for some countries that they collect data in an annual basis. We would have time trends, but for those that don't, we would just have whatever they collect. Then we have the harmonization methodology that Belen already explained. We have the indicators definitions that Belen already explained as well, and some other caveats and limitations. And basically, this is what we have. Let me see if I can finally show you this, or maybe not. Well, yeah, before, maybe in the meantime, if you have any question or anything related to this, please let us know. Yeah, thank you.
Thank you very much, Aspire team. Thank you to Victor, to Belen, and to Sofia. Those fantastic presentations, and really appreciate the fluid use of the actual portal and showing off the data aspects, and then ending also on some of the methodological information, because in fact we're getting a few questions on those aspects, on sort of harmonization and timeliness and inclusion of certain groups and other things like that. So let us move to the Q&A portion. We received about 11 questions so far. Those have come into the Q&A button, so please keep using that. If you'd like also, you're welcome to click on the raise hand button down at the bottom of your screen, and then I'll work with our colleagues at socialprotection.org to unmute your microphone and allow you to speak. What I've done so far is kind of group the questions that have come in kind of into 3 areas. So I think there's a series of questions around what I would call kind of data inclusion or expansion of what goes into Aspire. There's some questions on data collection and verification, and then also what I would call kind of data calculation, let's say. I think some of the answers will be in some of the resources that Sofia just showed towards the end, but let's start with kind of the inclusion aspects. And then Victor and Sofia and Belen, I'll leave it to you on who should answer. But here's kind of 3, well, sort of more like 2 questions. One is, are there plans to include OECD countries in Aspire, including like the US and some EU countries? Second is, are there any plans to move into what they call health social protection and health access data, and kind of align how Aspire views social protection with the ways that ILO would view the social protection floor? And then there were 2 related questions, I think, on the one hand, whether a lot of the data you include reflect refugees that are coming into different countries, and relatedly, how does Aspire generally approach migration data, and are there methods and proxies to address kind of the gaps and limitations that come with that? So already a lot to get through, and there's more, but please let's start with those.
Yeah, let me start, and then our team will contribute as well. Okay, so let me just combine the answer on this question in one, and Sofia will add. So the first about the coverage of the countries is very important question and point, whether we plan to include the high-income countries. We're talking about high-income country like US, Germany, countries in our database. Up until now, we didn't include this country because this is started, and this work is really, we're working on the countries that are part of World Bank engagement. And as you know, the World Bank really work in poor and developing countries. And this is our key objective of this exercise, was to have the data for these countries. And as I mentioned, we have 130 countries, but there are countries like US, Germany, that we do not include. Though I agree, and we know that it's for as a comparator, for comparison, it's important to have this country, especially if you want to strive to something, to see what is the coverage in the well-developed countries versus developing countries. And for many high middle-income countries, this information is really relevant. In our plans to extend our databases, and we already started exploring the EU Silk. EU Silk is a European mostly database for the EU countries, standardized data, and we will be working on this to include all the EU countries, high-income countries, and other countries we also plan to extend. So this is in our plans, and this will not have as extensive coverage of indicators for all the countries, but for the key indicators we would like to have. We're talking about expenditure, the coverages, the impact, and so on. We will have this in the coming years. It's our future plans. About quality assurance, it's absolutely crucial to publish and have the information that is really reflecting the information in the country. So we have a rigorous process of validation. The validation, I'm not going to go into all details, but just mention. So we validate our expenditure with outside sources, with ILO and IMF data, while their definition not exactly similar as ours. The inclusion is not the same, but many subcategories are very much comparable. So we compare our expenditures with those sources, and whatever we publish is something that passed this validation process. We also validate it with the countries who work on the country as well. So numbers we produce are validated with external sources, but also our internal validation process is happening. We are, important to say, we are the source of many of the indicators, and some of the indicators are very difficult to compare. Everything that we are producing on the impact indicators coming from the household surveys, they're really, we are the source. We are the production group that produce those indicators. So it's a difficult to compare, but at the same time, we work very extensively on checking the definition of the variables and so on, our microdata. And we have, by the way, very well documented information and files, metadata on how this standardization, or I would say even harmonization, not really standardization, is happening. This could be shared. And one important point to mention here, besides those aggregated indicators that you see on the website and you can download and you can work on, we also work on a microdata that is not always available outside the bank, because microdata is given to the bank by the countries, but we have a possibility to produce additional indicators. And also for some team, if you get a proper approval for the project, that access sometimes to the microdata when you can carry out your analysis based on this data. So those on the quality, on the inclusion. Aaron, can you remind me another question that I maybe didn't answer that I can cover? But in the meanwhile, Sophie, would you like to add anything to what I said? Or Belen?
No, thank you for your question. Yeah, maybe just adding on the vulnerable populations. Yeah, it depends at the end, like how well the survey is designed and if it's capturing vulnerable populations. As of now, we are not calculating indicators for specific groups. We are calculating for the total per quintal, for instance, or the extreme poor, but we have in our plans to calculate indicators for more specific vulnerable populations. So we would include these different types of vulnerabilities. So including what you were mentioning, migrants and maybe displaced people.
Yeah.
And let me just jump in the administrative data. If the country has a program that targets refugees or migrants specifically, and it's relevant for the social protection system of the country, we would have it at the program level in our data set. So if the program is relevant for the country, we would have it.
Important for me to add to, and it was a question about this, but I just want to expand. So there is a methodology exists in the way we organize our data and prepare. You know, our data, as we mentioned, have, first looking systematically on how the country spent and where they spent, going from very top down, from the, we have total expenditure, the areas, to the program level expenditure. So you can see the program by program. You take country, Ethiopia, you will know what type of programs they have. And then also we have information about what type of programs they have. If the means tested program, are they targeted to the poor, and all kind of additional array of information is there. We also have a methodology how we look, okay, beside expenditure and the type of programs, we look at the performance indicators, and here we have indicators that we design. Important to say, so we are working now, we'll be working with ILO, and it was a question that I didn't mention. Their definitions of the World Bank and ILO and other agency, we are very close to each other, but not exactly, right? The ILO have a lot of emphasis on first of all, on statutory programs, and also on some labor market programs that we not necessarily always include. We include all the programs, not only statutory, but also our some of the indicators are not fully aligned with their definition. It's not completely different, by the way. We probably 85% aligned, but some definitions are not the same. So now we have activity that we started with the ILO to align better in our definitions and work together in a couple of dimensions. On our definition to align, we're very clear why the differences could be with them, but also we would like to design guidelines to the countries on how better capture information in the household surveys. Because if the household survey does not capture some program well, we will not be able to analyze it well as well. And this is happening in some countries where we don't have full coverage of all the programs to analyze because of these deficiencies of the data. So we are working with ILO. We'll be working, a new project will be coming so soon, where we will be aligning in these areas. And generally, we are better aligned with IMF. We are very close to them. We are meeting, and they're using a lot our data for their analysis. They created actually tools based on our databases. So we are much closer aligned in the definition with the IMF, their fiscal departments. And the last I want to mention, if you work, and I see that based on the participant, we have people in different countries from the agents, from the ministries as well. The World Bank generally provide technical assistance to the countries in many areas of social protection. But what we can provide you is, if you would like to learn more on our definition and how your data can be used better for the policy analysis, we are from the global Aspire team, but also with the country team, can work together, provide you with explanation, but also potentially a training on how you can use this data for the policy analysis. We've done this in many countries. In some countries, we work with the ministry. We systematically show how these indicators can be used for their policy discussion, for the analysis of their own data, and from the program to the overall system. So this could be very useful for many countries. We've done it in many countries already, and we will be happy to provide you with this type of assistance. But of course, it has to be discussed with our country team and us. But I just want to let you know that there's another possibility of us engaging with them. Back to you, Aaron, if you have more questions there.
Great, thank you, Aspire team. That was an excellent first round. We have about another 5 minutes, and I am quite sure we're not going to be able to get to all these excellent questions, but let's dive into the next round. And I think these focus a little bit more on what I would call data collection and verification. One, I think, quick question is, how does Aspire show or flag when data was collected? And then there are a couple more questions. One on how are duplication issues addressed, such as when one beneficiary might receive more than one benefit from within one program or across multiple program, and that's correlated with the same person giving an example of in Pakistan, programs for social protection may run at both federal as well as provincial level without an integrated information system. And in those cases, how are you collecting your data and making sure they stay up to date?
Yeah, let me start from the second question, and then maybe Belen can answer also on the first question. So it is a very good question about the overlap. If you use just administrative data, it's very difficult to add up the program, because some beneficiary, some person can get 2 or 3 programs. It could be some family. They have children-related pensioners you have in the family, and the same child could have a different type of program. If you just add them up, you can get more than a population coverage. So it's not the right way to do it. The way, the methodology that we are using is we use household survey data for this analysis. And household survey data is opposite of administrative data. We know in a survey we have individual, and we know all types of incomes this individual has, or the household level, all the types of income. So when we calculate coverage, right, or any other indicators, we look at the household, all type of, we don't double count, because we look at all, as you can see this table, you can have social insurance and other type of programs and social, different social benefits, but it will be only counted once, right? But of course, so the coverage, whatever you saw, like 75%, meaning households getting at least one of the programs. This is possible to do only if you use microdata, meaning survey data for the analysis, and this is where we specialize in. And this is something that is relatively unique and Aspire, because this is what we do in our indicators based on the household income and expenditure, household budget survey, SILK, and other surveys where they have this information. So this is one important, and we are happy if you have more questions, more detailed technical questions, happy to come write to us in our email address. Maybe we can put it in a chat room, and we can answer you how you can do it the same or how we do it. And the first question, maybe Belen can answer how we flag the countries. Back to you, Belen.
Yes. Well, as I explained before, we follow a process, like a process for collecting data. For the admin side, like for the household service side, it's more simple, because it's simpler, because the data it's provided to us, so it's simple to keep like track of the data. For the admin side, sometimes it's a little bit confusing, or not confusing, it's more complicated, because we could receive different data from different sites. So what we do, it's for, we collect, first of all, we collect annual data for each country, and as Victor was saying, we collect program level data. So what we do, once we assess, when I said that we assess the data of each, our first starting point when collecting data is to assess the data that we have. We have the list of programs that, let's say that we start updating Peru. So we have the list of programs in Peru. We have the 2022 data for Peru and all the programs that we have there, and we receive the new data for Peru, and we compare what we have already in Aspire and the new data for us, the new data that the government or the consultant share with us. So from that would be our starting point to start reviewing and flagging how to see and to process how to process the standardization on it's difficult to explain, but how to standardize the process of the data collection. So we assess the data that we have, we compare the data that we collect, we check if there is any change in the data that we already have. If we have the data, there is an update on the data, we ask questions, we review the data, we go back to the team who collected the data and ask if there is any mistake or whatsoever. They check the data, and then we go back and we finish the annual year.
Sorry. Thank you,
just to add clarification, to clarify, we at the World Bank organize the following way. We are a global unit, but we have regional units and country unit. The country unit is social for the working with the ministry usually. We work with our country unit who help us to collect information, and they work with the ministry usually, Ministry of Labor, State Office, and others to help us with administrative data collection. They provide us this data in a certain format that then we aggregate this. Then we will come back to them and they validate that it's working, this validation. Then this data is used for our aggregative indicators, but also we draft briefs on social protection briefs for the countries, and then they also validate it through these sources. So that process is a constant back and forth between us, our country team, and the government. Let's put it this way: we ourselves rarely collect data directly from the government because our country team know better about the country work. We also have social insurance team, the pensions team, that they're really special on pension data. They help us with the pension data. We also work with G2PX team. G2PX is the payment team. They validate, and we work with them systematically on the payment type of information that we have in our database. We have school feeding data in our databases. Here we work with the nutrition team in the World Bank, who are food and nutrition. They are really specializing in this. So we have other groups that we work with, like our DEC and our research group, also validating data, and we are source for their data. So we are really well integrated kind of group with other data producers within the World Bank and sometimes
Thank you,
outside.
Victor.
Aaron, back to you.
Very helpful description of how the whole process and the verification all comes together. So we are at our time. I realize we did not get to a few of our questions, so I'm going to ask the socialprotection.org team and our Aspire team to make sure we make note of those. And they've also already dropped the aspire@worldbank.org email address into the chat. So please, as Victor's already and the team has invited you, please go ahead and just send your questions directly there and they will get back to you. They're very responsive and very interested in supporting folks to be able to use the portal and all the information you've seen. As we come to a close, just a big thanks on my part for everyone who joined, all the interaction. When the webinar closes, you will be sent to a survey. So please go ahead and fill that out. That helps the presenting team, that helps socialprotection.org just to understand what works and what we can always do better. The recordings will be sent out within a couple of days as well from this session, as well with any of the additional resources. So again, thank you everyone. I hope you enjoy the rest of your days. Good day, good evening, good afternoon, and look forward to joining you next time, and look forward to seeing you use the Aspire portals. Thank you.
Thank you.
Thank you.